Hello, parents, guardians, family members, and district representatives. A warm welcome to the virtual edition of the Newton County Schools Parent Connect. I am Shabry Jones, and I'm truly excited to have you here. As a member of the Instructional Technology and Media Services team, our core focus centers around the 3E model. This model aims to provide students and teachers with enriching experiences, promote active engagement, and ensure a diverse range of exposure. In today's session, we're honored to be joined by our partners from Hazel Health. Their service offers vital mental health support to students, whether they're at home or at school. Presenting today are Heather Henry, Amber Dutton, and Christina Hanna. And I believe we have one more that would be Miss Asmerit Ashford as well. So please note that today's session is being recorded, and you'll be able to access the recording through our Parent Connect Canvas page. Following the presentation, we'll open the floor for a question and answer segment. So feel free to type your questions in the chat box, and we'll address them at that time. Ms. Henry, take it away.
Good morning, everyone. Thank you so much for joining. We are super excited to share with you all about Hazel Health and the services that we have to offer to your students in Newton County. All right, so here's who we are. So I am, well, it was Heather Henry. I recently got married, so it is Heather now. And I am your account manager, and I handle a lot of the district relationships, the pulling of data, anything that the district needs. I am their first point of contact, followed by Christina Hanna, who is one of our customer success managers, who primarily is the one working with all of the schools that your students attend. We have the fabulous Amber Dutton, who you'll hear from, who is our clinical supervisor. And then lastly, you'll hear from Asmerit, who is the one that is actually seeing a lot of the students in Newton County. All right, so here is the whole range of your Heart Georgia therapists. So a lot of these therapists are already actively working with students in Newton County, and they are all super fabulous. They are licensed in the state of Georgia and just super excited to get to know your kiddos and support them. So who are we? We are Hazel, and we are the largest, most trusted telehealth solution for K-12 schools. We have our services available at home and at school. And the best thing about Hazel is that regardless of what kind of insurance status you have, whether you have insurance or you don't, this is no cost to families, which is super fabulous. All right, so as you can see, here is our roadmap across the country and all of the districts that we serve. We partner with over 150 school districts across 14 states, all the way from Newton County to Clark County and Vegas to several of our largest counties in Florida. We truly are just getting started, and we are so excited and think you're really going to love even the more students that we're going to see next year, and we are adding new states. So super excited that Newton County has partnered with us. I think that our mental health services are one of a kind and are extraordinary. And so just super excited for you guys to learn more about Hazel and how your student can be seen, heard, and cared for. All right, so this is kind of going through, what you currently might have offered. Students who need care may not currently be able to connect to services, and then how we are unique in being able to address the needs of your students. So not only can schools refer, but parents can also refer. Our services, like I said before, are provided at no cost to families. We have an amazing back-end customer-facing team from family resource managers and enrollment coordinators to really kind of get you started and make sure that your child is consented and schedule those appointments that fit in around your busy schedule. Or we also have those at-school appointments as well. And then, of course, you always have the ability to be able to join virtually. One of the things that is great about Hazel too is that when you're waiting for that long-term care, we're kind of the stopgap, and we have the capacity to support your child until they can get to the long-term care, or maybe they just need 5, 6, 7 sessions and then they're good to go. So we take pride in having shorter wait lists than several other options that might be available to you in the community. And Christina, I will let you take it away.
Hey everyone, my name is Christina. I'm the Customer Success Manager with Newton from Hazel Health, and just wanted to go over a couple of statistics regarding mental health in Georgia. So we know that 1 in 6 children ages 6 to 17 experience a mental health disorder every single year. And 68% of the youth aged 12 to 17 who have depression did not receive care last year. And we also know that 50% of people with a mental health condition did not receive care last year either. And so some of these statistics, including suicide being the second leading cause of death for children aged 10 to 17, and students are 2 times more likely to drop out of high school with a diagnosis of depression. And then, as Heather said, with our costs, our services being at no cost, the statistic of 45% of those in Georgia who needed mental health care did not receive that mental health care due to cost. So we are here, like Heather said, no cost for students. And then we also know that over roughly 5 million people in the state of Georgia reported that they did not have enough mental health professionals in their community to access those services. So these statistics in Georgia are very alarming. And so we at Hazel are here to help decrease these statistics and help better the students in the community. So you may be wondering, as a parent, how you would get your student signed up for Hazel services. And so this is a 2-step process. So the first step would be to fill out the consent. So you can go to this website or use the QR code that will take you directly to the landing page to sign that consent as the guardian. So once that consent is completed, the next step would be the actual referral. So the referral can come from 2 different ways. So that referral, you can connect with your school counselor or school social worker to request them to complete that referral. Or as the guardian, you are able to call Hazel directly, and the number is provided here. So that is 1-800-76-HAZEL. And then you would just request those heart services for your student. So again, a very quick 2-step process, filling out that online consent, and then getting that referral to get services started. And when you're completing the consent form, one of the things that you may notice is that insurance information is requested. But please know that even though insurance is requested, you will never, ever, ever receive a bill from Hazel for any services provided. The reason that we do request insurance information, so we are a healthcare company. And so when we do have insurance information and we are able to bill the insurance, we can ensure that the visit cost is reimbursed. And we can ensure that there is no out-of-pocket cost for the family. And then with being able to bill insurances, we are able to have a better care coordination, which can include referrals to long-term care and ongoing follow-up from our team. And in turn, that can also mean quality, timely mental health care for your students. But please remember that insurance is not required to utilize Hazel services. So if you do not have insurance, again, you would still be able to utilize this service for your student. And so a couple ways to submit your insurance information. First is going to be during the consent portion. So if you are completing that online, this is what it would look like. So you can upload pictures directly of your insurance card. But please remember, if you do not have a picture, you can just type that information in manually. You can also provide your insurance information over the phone. Again, that's our 1-800 number. And in some cases, you may receive a text message with a URL to submit your insurance that way as well. And if you're ever wondering what the school referral may look like, this is just a quick example of what the school staff would fill out in that referral for your student. So it would just be that basic demographic information for your student and yourself as the guardian. And then our team just we would like to know if you as the parent guardian were contacted about this service. And then it goes into the reason for the referral. So you can see that your school counselor would choose the reasons and have the additional text boxes to include any information that would help our providers best serve your student. And then, as we mentioned, schools, our services are offered during during school hours. So this box here with the scheduling session would be available for the school staff to identify what is the best time of day and what day is best for your student to have those sessions in school. And then they're also able to know any scheduling considerations. So if there is a common class, a common core class, or lunchtime that your student does not want to be pulled from, the school counselor would be able to note that, and then our team would work around that to do what is best for that student. And now I am going to hand it over to Amber.
Hi, good morning, everyone. And so I'm going to walk you a little bit through our actual referral process and how a student actually gets to our care. And so as Christina was mentioning, once a referral is made, typically within 2 days, a family will receive a call to schedule that first intake appointment. And what that intake appointment entails is really getting that background context of what is going on with your student. And that way we know how best to support. And so again, the referral can come from, again, the school or the parent. What we ask is that if the parent does a self-referral, that you also remember once you do your consent online, that you'll need to actually call into Hazel to get that referral generated. And so again, once you move there, then you're going to go ahead and be outreached by what we call a family resource manager or an enrollment coordinator, who's the one who gives that preliminary information, again, such as your insurance, and really understands kind of where is the best to schedule the appointment at school or at home. Both, again, are virtual. And then again, they identify the best time that that student should be pulled to do that intake assessment. Our intake assessment lasts 75 minutes. And so we do ask that the legal guardian is present to be able to give helpful input within that. And so once that intake assessment is done by our intake therapist, then that student is going to get assigned to an ongoing provider. And then that therapist is going to determine, based on the presenting concerns, how clinically long a student should be with us. On average, a student is with us about 2 to 3 months, but this can vary depending on their clinical need. Once that occurs, then that ongoing therapist may determine, with consulting with the parent and student, if additional resources are needed. And so if they are, then we will have that family resource manager outreach and provide some additional resources such as long-term therapy or maybe even a local psychiatrist. And sometimes we also may refer back to the school if we identify that maybe there's some additional supports that that school could help that student and family with. And so we have our family resource manager. You can think of them like a case manager, and their job is to be able to check in roughly within 6 months after a student is discharged from our care, just to see if there's any additional support that we can offer. So how can Hazel help your student? We have many different reasons that a referral may come in. So academics, bullying, eating changes, you know, you guys can read through this list, but sometimes there's a little bit of confusion around mental health services. And again, if there's any changes or anything that you may notice about your student, it could be as simple as moving from one state, moving from one county to a different one, adjusting from going from elementary to middle school or middle to high. It could be that there was ongoing stress. So on the right side, you'll see that these are our top 10 referral reasons that we may see. And then on the left side, these kind of dig a little bit more into what those look like. And so if you ever think that there's anything that your student may be presenting with and you're just uncertain, this is really kind of the benefit of our service, is that we are short term. And a lot of times this can allow you to allow you to identify if your student needs additional supports in place. And so Hazel can be a perfect fit to address some of those short term instances that may have come up. So working with the heart provider, what does that really mean? So again, some of you may wonder, what does the acronym HEART stand for? It means Hazel's Early Assessment Response Team. And so again, what our heart providers do are they are trained licensed therapists. And so they come from different backgrounds. We have licensed clinical social workers, licensed marriage and family therapists, as well as licensed professional counselors. Our therapists have worked in many settings, from the schools to child welfare, foster care, youth detention. Most of them have done, of course, previous inpatient or outpatient counseling services. And the most important thing is our therapists love the work that they do, and they enjoy working with youth of all ages. So they are really good. We have a phenomenal dynamic team over here of therapists. And when I tell you they work hard for you, they work hard for you. So they really want to make sure that they're identifying the type of treatments and additional supports. They often go above and beyond, really coordinating with you as the parent to understand what your child may need, and also just giving some education, because sometimes you may know that your student needs something, but not quite sure. And so their job is to be able to guide you into understanding some additional supports that may be able to be offered. And so again, we also like to make sure they're educated on what's important to you as a district. So while we serve other school districts, we also want to know, like, what's important in Newton County. What are the issues that are facing? What are the concerns that you see in your schools, your neighborhoods? And they really want to make sure they're hearing and getting your buy-in on what's important to you. So we have a feature where they can communicate with you through phone call or through chat. And this comes through the parent account that you would be setting up. And so that would be the main ways that they communicate. And then again, what's the great thing is that all of our team of Georgia therapists, they do reside in Georgia. And so in a virtual world, we oftentimes have therapists that live in other states, but serve a different state. And so they all live in different parts of Georgia. And while they don't go in person to the schools or to your home, they still are available to offer that support because they understand the dynamics of our state of Georgia. So as we mentioned, there are different spaces that the therapy can happen. So school therapy spaces and home spaces. These are some examples of what a space may look like. And so we really encourage, when we launch into schools, is that counselor, that principal be really creative with that space that they are creating. And so we encourage that they're bright, they're bubbly, that they have supplies and tools in there that your student may need, whether that's crayons and art supplies. And usually the therapist is going to be the best one that may notify whoever is supporting your student into making sure that they are set up and have some items in the space before their session. So it's a private space. So the school staff are available to support transitioning the students from class. So normally, again, they have a dashboard that they use through an iPad. So you'll see one in this lower left picture. That's the iPad that the student actually is going to do their session on. And so what happens is either someone from the school, whether it's the secretary, they may call the student from class. For younger students, they may accompany them. For older students, they just get a pass to come from class, and they also get a pass to go back. It's confidential and discreet. So we know that some students prefer home visits because of that stigma of, I don't want anyone knowing that I'm in therapy and getting therapy at school. I can tell you myself, as a school-based therapist, I was very discreet how I pulled my students. And they just thought, they were going to the counseling office. And so I know that some students there can be a stigma of, I'm going to the office, I'm in trouble. And so we really try to work with that teacher to make sure that they're discreetly getting that student up to their session. That way it can feel confidential. And then again, it's remote. So the therapist is going to be joining from a computer or iPad themselves. And again, for our intake appointments that happen at school, what happens is the parent will get a virtual link. So you can do the intake from the comfort of work. If you need to take a few minutes away, we usually ask the parent be involved for a minimum of 30 minutes. And so you're not having to come to the school, pick the child up, go to a clinic, but you can actually join in virtually and be on the screen with your student if you're not able to do your intake assessment at home. And so our sessions are individual therapies. So the parent generally does not participate in ongoing sessions beyond that intake appointment, unless again, that therapist is collaborating and for some reason requests that that parent join the session. And then home spaces for therapy sessions. So here are just some things that are helpful to know. So again, as I mentioned, the student will join their session virtually. So even though we say it's a home session, that therapist is not actually going to the home, it is still a virtual session. And so you can join from a tablet, a computer, or a phone, just any type of smart device. Sessions occurring at home, as I said, are still virtual. And as a parent, you're going to receive the reminders 2 days before the appointment, 2 hours and 15 minutes before the appointment, again, with a designated link. We do request that an adult 18 or older be physically present in the location where the session occurs. So it doesn't mean you need to be in the room with the student unless it's that first appointment, which is that intake. But we do request that just for safety reasons that there is someone 18 or older. And so this doesn't have to be the legal guardian beyond the intake. It can be an older sibling or an aunt, uncle, whoever, as long as they're over 18. We want to make sure that also that we remember privacy. So sometimes we know that doing a virtual session feels convenient, but we want to make sure that your child still has a safe space to be able to open up and really have that therapeutic space. And so we do ask that virtual sessions do not occur in a car, especially a moving car, in public, at the grocery store. And so this is really where you're going to want to make sure you're communicating with your therapist if for some reason you're not able to make that appointment, because we want to make sure that they feel your student feels respected and has a quiet space to do their session. Comfort. So we talk a lot about some students really, again, are just more comfortable engaging at home. But we also see that it could be more students are comfortable engaging at school, depending on, the dynamics, that there's a lot of siblings. Therapists find that they can be a little bit more creative with their activities because, again, maybe you as the parent are able to do different things that maybe the school was not able to do. And so sometimes this can allow for a better relationship building really with that therapist and really having you a little bit more involved in those sessions than you would at school. And so now I'm going to be turning it over to Osmaret, who's going to talk a little bit more of her experience from the therapist side of things.
My name is Osmar Ashford, and I am one of the therapists on the Georgia Heart team. And I had the unique experience of being a former Newton County counselor. I was employed with the county for 17 years in several elementary and middle school settings. So I have a special connection. Newton has a special place in my heart. And I'm here to talk to you guys about, well, first off, my workspace. These are pictures of some of my workspaces. And anybody who knows me, because I see a couple of familiar faces here, knows I am bright, glittery, all things shiny. So these are my workspaces. And I do whatever it takes to grab the children's attention. So whether it's the headbands, I had one, if you look on top of the ring light, there's a Mickey Mouse headband. Cute story. I had one student who anytime he needs to calm down, he had to think of his trip to Disney World. He would just go into his own magic space. So when I had to refocus him, I put my Minnie Mouse ears on and the glitter, and it stopped him. It calmed him down. So I am very make sure I find ways to engage with them because we're remote. So I have to grab their attention and keep their rapport. So I do believe in my props. One of my favorite for the youngers, or as I like to call them, the littles, is my calm down jar. This is something that I use with them to show where we need to be. There's little specks of glitter going around because when they're getting to be a little too active, I show them, give them visual representations of where. So this is where you are, and I knew where we started. So we might need to take 2 or 3 minutes to watch the glitter settle down. So these are just some of the little tactics I do because, again, building rapport, people think it's different, but it's not. You just have to know what to do with them. My bag of buttons, and I have books to go with all of them because, again, like I said, I was a counselor for 17 years. So I do bring in my SEL training and my resilience training. So for every prop that I have a handy dandy book along with it. And believe it or not, even mine that don't like to read love to be read too. And sometimes we read it together for those who are struggling with reading. So as a former educator, I always bring in a chance to teach. But my bag of buttons, when they're a little hyper or when they're letting people bother them, this is one of my tactics too. I tell them, you're giving away all your buttons. You need to keep your own buttons. So these are just little tactics that I use to keep them engaged. So these are some of the things that you see on my desk. So sometimes when we need to talk about things, I ask, let's rewind. And again, you have to be engaging and entertaining and very creative in our remote space. So sometimes we have to physically turn around and rewind the day. And we talk about what happened. If I bring out my magic wand, they automatically know we're rewinding the day and talking about what we could have done differently. So it definitely needs to be a private session because sometimes we're making lots of noises and we're and things. So if I work with your student or if I'm working with your child at home, if you hear some unique noises, that's us. We're being creative because you have to grab their attention. And it needs to be a private setting because we don't always want to explain why we're making these fun noises. Okay, so we can go on to the next slide. And with the elementary students, and each of us have our own mix. So some of my coworkers or co-counselors, they do different activities. Some of them do mindfulness training and yoga, they teach breathing exercises. I'm a little more upbeat and my people usually need a little more fitness with me and I made up. But I do like emotional learning where I always find a way to incorporate a different book. If you're having trouble with anxiety, we talk about and some of the challenges he has. We have about the buttons. We also do therapy. I do art with them. One of my first building activities is where they draw all things so-and-so. So I'm going to just randomly pick a name, Bobby, all things Bobby. So his first assignment would be to give me a drawing so I know what he likes, what he doesn't like, what makes him happy, so that I know what to and what not to do. With middle schoolers, believe it or not, a lot of the that we do, guess what? My middle school get the magic wand where we go back and think about what we could have done. Okay, so high schoolers, they're a little easier. We do a lot of talk therapy. And lately, I teach relaxation techniques. I don't let them fall asleep in school, though. I make sure we understand that's not acceptable. And you can't say Miss A taught you how to fall asleep in school. It's not acceptable. But we work on goal setting and we challenge their thought processes. Like, okay, you did it this way. I don't have to be as fluffy with them. But what's interesting is a lot of my high schoolers respond to music. So sometimes we have to dig deep into their playlists. And sometimes it's a little scary, but we go where they are to go through the songs and understand what we're talking about and how that relates back to everyday life. So there's always going to be a lesson in it. And I do get parents' permission before we listen to certain songs, but I go through their playlist because that's what they're listening to. And if I want to reach them, I have to go where they are to bring them where we need them to be. Okay. With my littles. Again, it's so much fun grabbing their attention online. And it's people overthink it a lot of the times. We need to go back to the basics where we're teaching them their emotions because they think they know, but they're not 100% sure. So Inside Out is one of my favorite things to do to introduce what we're going to do. We go through each of the characters and we talk about how they may have experienced disgust, fear, joy, sadness, or anger. And I think my last session on Wednesday night, I don't know who was more excited. We watched the trailer for Inside Out 2 with the new characters coming. I am excited. I will be there on opening night. And if I can do the preview, I'll be there too, because this is my go-to. I love it as an adult. But if you indulge me for a second, we're going to watch my friend Fear here.
When the unexpected is staring you in the face, Fear is there to keep you safe. With speed and wisdom, Fear assesses the situation and settles your nerves in his own special way. He's got this. Thank you, Fear. Get to know all your emotions with Disney Pixar's Inside Out, rated PG.
Again, I'm so excited about Inside Out 2 coming out because I get to introduce 4 more characters. And it's quite exciting. And one of them is a French character. So we're going to go so many places with that. I'm going to get my beret ready soon. Okay, we can go to the next slide. Okay, so if you guys were my clients for today, the first thing we would do is discuss fear. We talk about how are you similar to the character Fear. For me, I have no shame. I tell them up front, if it's a big dog or a spider, I'm running. I am Fear. I am all of those things he were with a bow in my head. I am running. So again, I let them know that what they're experiencing is nothing different than what we're experiencing. We just have to find a productive way to work through it. Now, I'm not working through bugs. I'm calling somebody. But outside of that, we do this together. We talk about what we discussed their causes of fear, how to express it, and how to overcome it. Slowly but surely, we work through these. So this is the goals on fear. We practice. We do make funny faces. That is another reason we need to be in a private place. So they show me their expressions. Sometimes we play gestures or charades, I guess, for lack of a better word, where I have to guess their emotions, they have to guess mine. And again, that's building rapport and letting them know that we don't have to be stuffy. We don't have to sit there and say, how'd you feel today? Because that's not me. That wasn't me in a school setting. That's not me in real life. So that's not what the children get here. So we go through the different activities and we take out the key points, and so that there's always a takeaway. So even though we're having fun, they're still learning, and I bring it all back. And if they're a little distracted again and my buttons or my calm down jar didn't get them, my favorite rubber ducky will. So sometimes we have to come back with some distractions to bring them back to where we need to be. So that is a mini version of one of my sessions. Questions?
Okay, so we have quite a few questions in the chat box. So the first question says, what are the pros and cons of choosing to refer a student through school as opposed to calling it in over the phone?
Yeah, I can take that one. And so it sounds like maybe you're asking about a self-referral versus a school referral. And so I was just putting a response in the chat that usually when it comes to a parent self-referral, you know your student best. And so sometimes really that consent being completed is the thing that can really get you to that intake before. So when a school refers, so the school can refer with your consent or without. And so again, if they identify that, hey, I think little Timmy here may need therapy services, they are encouraged to do their best to be able to outreach to you as the parent and let you know that they may make a referral. And so sometimes we see that there could be a disconnect, or if the parent isn't aware or in agreement with wanting to initiate Hazel services, then that can be the reason that the services, there's a lag in it. And so we usually say that when parents refer, we understand that you have identified a need. And so this is often sometimes the best ways that we see that. But again, if you're not sure and you want to consult with your school and hear from that school counselor or the social worker, they can advise you again, because usually your schools are also going to have a school-based mental health therapist on site. And so sometimes, you may want to go to them to identify the direction. If a student has too high of a needs, that's beyond what our virtual platform can handle, that school counselor may be really pivotal in directing you towards their school-based counselors. And I know, again, you guys have Apex therapists in your schools. And so that sometimes may be the better route. So we always say sometimes just consulting with the school is the best start. But if you're like adamant and know that your child needs help, then do that self-referral.
All right, good deal. So there is 3 more questions, but I think you kind of answered the one about the school counselor, also with the mental health counselor as well. The next question is, what is Hazel's staff capacity as it relates to Newton County school system?
Yeah, great question. Absolutely. So one of the benefits of having Hazel is that our therapists are not bound to a certain number of schools. So I also was the Apex therapist and an Apex program manager. And I know that I was assigned as a school-based therapist to about 4 schools. And so for me, that was driving to different schools in different areas. This was out in Athens. And so my day, a lot of time was spent driving and getting resituated. So our therapists, on average may have a caseload anywhere from 20 to 40 students per therapist, depending on just the number of hours that they work. And so what we really do is we determine based on the needs that are presented with the demand of the referrals we have coming in to really warrant if we need to add additional therapists to our team. So right now, as you've seen, we have a team of 7 therapists and 1 intake therapist. And so once we really identify if they're at their capacity, that is an internal decision that we may make to get further therapists that support the students. And so we don't want really big caseloads because we also want to make sure that each child is getting the care that they deserve. And we know that higher caseloads can lead to less care that way. So we do balance it out, but in no way I can tell you that any of our therapists are at their max. And so we encourage you, if you're hesitant or thinking about our services, please, talk to your school or do a self-referral, and we'll make sure. Our time to care right now is super short. So again, we know that this is the benefit of Hazel, is that with traditional therapy services, sometimes you can be on a waiting list for 2 and 3 months. And again, this is why we call ourselves the gap service, is we want to get your student in super quickly. So from time of getting a referral, whether that's you as the parent or the school, up until the time that you get in front of that therapist, it's usually on average about a 2 to 3 week process, assuming that there's no hiccups along the way. And so we are in no concern at being at capacity. So, but those are some of the ways that we make those decisions of how many students a therapist can have.
Awesome. Now, with autism care in Georgia, how prepared is Hazel personnel? How prepared are they to deal with this population of students with autism?
Absolutely. So what we encourage, our job is to not turn any students away. And we do see students. So one of the things we do like to emphasize is that we don't duplicate services. Now, if a child is already in individual therapy with an outside counselor, we do say, and this is usually for billing reasons, that child can't be in individual therapy, let's say with the Apex provider, and then also receiving services from us. With autism, it's a little different oftentimes because depending on the level, that student may also have like ABA services. Now, ABA services is a different billable code and a different type of services than we provide. And so a student could be getting individual therapy and ABA at the same time. However, what we really do in that intake appointment and then as the ongoing therapist is we do evaluate that clinical need. One of the things that we encourage is through virtual therapy. We want to make sure that the student is able to engage in talk therapy and really be able to participate. So if this is a student with severe autism versus a student that's a little bit more high functioning, what we're going to say is that maybe this may not be appropriate. And it could be that that student needs more in-person support, or maybe working with a registered play therapist or a therapist that can go a little bit slower. And that's really kind of determined, like if we're seeing the student bouncing around the screen, do they need the parent to redirect a lot? So sometimes we do make those clinical needs. And if we are saying that this may not be the best fit, we're going to then turn them back and either give them resources or encourage them to talk with the school about some alternatives, like maybe working with that Apex provider. And the same again, just like with a student who has an IEP or a 504 plan, the same concept is that we're really going to evaluate those students' needs. We don't fulfill the request of an IEP, we can supplement it if it's a different type of service. However, we know that there are very specific requirements. And so we just like to be careful that the student is getting the best support. And sometimes that means that Hazel may not be the right fit just because they may need a little bit more than us.
Awesome. And let's take one more question. I see here it says, do parents have to enroll for the Hazel program for their student?
Yes, so really the word enroll is just being able to do that consent. So as mentioned, it is available to every student within the district. The only thing is just doing that consent. And so again, this is the QR code that's right here on your screen. Once you do that consent, you're essentially saying like, hey, you agree that we can reach out to you. We can go ahead and get that intake appointment scheduled. So no child is served without consenting. Now, the only time that we do see a student is if we have a process, and myself as a clinical supervisor, if a student is at a school, the school counselor can have the right to initiate what we call a crisis consult. If a student is presenting with maybe suicidal thoughts, self-harming, really anxious, we have kind of that on-demand service that clinical supervisors can support in. But beyond that, yes, the family physically needs to consent to our services before we can move forward with those.
Awesome. Thank you so much. Thank you, Ms. Henry. Thank you, Ms. Dutton. Thank you, Ms. Ashford and Ms. Hannah, for providing our parents with this information. This is truly a great resource for our students and our parents, and we thank you so much for joining us today. Please remember that this session is being recorded and it'll be available to you after the winter break. When we return, it'll be on our Canvas page for you to refer back to it. We also encourage you to save the date for our next session on March 8th, where we will talk about kindergarten roundup and the Newton County STEAM Academy application process with our friends from NCSA. And we're eagerly anticipating your active participation, and we wish you a wonderful weekend ahead and an awesome winter break. Thank you so much. And thank you, Dr. Benton. We appreciate you. Y'all have a good weekend.